Good afternoon. Today I'll be presenting my research on simulating focused ultrasound therapy in bone. The motivation behind the research is for the treatment of the painful benign bone tumor called osteoid osteomas. It's most frequently found in the long bones in your body and commonly found in younger populations aged 5 to 24. We can see in the CT scan what an osteoid osteoma looks like. An MRgHIFU clinical pilot study was conducted and performed on 6 treatments in 5 patients at the Hospital for Sick Children and the Sunnybrook Health Sciences Center. After treatment, 4 patients had no pain after just 1 treatment, but 1 patient had significantly reduced pain after 2 treatments. The purpose of this research is to develop a graphical processing unit-based MR-guided HIFU simulator in order to enable clinical treatment planning as well as assessment. And there's 3 components involved. And first is the MRI segmentation component, which uses the k-means clustering algorithm. Second is the acoustic simulation, which uses the Rayleigh integral. And finally is the thermal simulation, which uses the Penz bioheat transfer equation. And the Rayleigh integral and Penz bioheat equation are calculated by the parallel GPU in order for fast computation time. The goal is to be able to reproduce the heating distribution of the clinical treatment in order to allow for intraoperative assistance and better prediction of temperature within the bone. So moving on to the segmentation component of the simulation. On the left-hand side here, we can see an MR scan of one of the patients who is treated, and this is an axial slice of the femur near the hip region. And you can see where the osteoid location is as indicated by the arrow. After the k-means algorithm segments this unlabeled image, on the right-hand side we can see now we have a labeled image with the center labeled as marrow and the surrounding tissues to the marrow labeled as cortical bone and the surrounding tissues to the cortical bone labeled as muscle. Moving on to the acoustic simulation, again the Rayleigh integral calculates the acoustic propagation of the HIFU waves towards the tumor location, and it calculates both the reflection and refraction at each tissue interface until finally it calculates the velocity distribution at the tumor location on the segmented image. So after we have this velocity distribution, another calculation is performed to find the pressure distribution. And then another calculation is performed to find the heat distribution. So this brings us to the thermal simulation component of the model. On the left-hand side, we're looking at a real-time MR thermometry sequence of one of the sonications of one of the clinical treatments. You can notice that there's a lack of signal of the MR thermometry within the bone. On the right-hand side is the simulated temperature distribution based on the Penz bioheat equation calculations, and it's overlaid on top of the segmented image, as you can see. On this slide, we're looking at a max temperature comparison within the tumor region of the clinical versus the simulated data. And after 20 seconds of sonication, you can see the difference here is 2.58 degrees Celsius, and after 40 seconds of cool down time, it's 0.9 degrees Celsius. However, you can see how much the clinical data fluctuates. Looking on average for each sonication of all the treatments, the max temperature after 20 seconds of sonication comparison was 1.84 degrees Celsius, and after 40 seconds of cool down time, negative 5.1 degrees Celsius. So the Philips accepted quality assurance standard measured in a phantom gel is to be accurate within 5 degrees Celsius. So we fall within this range, however, the standard deviation is higher due to the lack of thermometry signal within bone, as well as the low SNR of the thermometry. Looking at the simulation time, the maximum for all the sonications simulated was 114 seconds. So based on the average preoperative MR acquisition time of 5 to 10 minutes, we can fit multiple simulations within one acquisition, which means this is clinically feasible. Conclusions based on these results is if we can reproduce this temperature distribution with a computer simulation, this can enable pre-treatment planning and intraoperative assistance and allow for a better temperature prediction within the bone. This has the potential to save clinical time and improve the overall safety and efficacy of MR-guided HIFU treatment of osteoid osteomas. I would like to acknowledge the funding sources as well as the collaborators. Any questions?
Thank you very much. Are there any questions?
Nice work. Can you also model then the temperature distribution into the bone? I'm sure you cannot see it on the temperature images, but could you model it?
Yeah, right. So that's the idea. You can actually see what the temperature and thermal dose is going to look like within the bone tissue. So that's one of the ideas of the simulation, is to give a better prediction to see what's going on within the bone tissue.
And then a follow-up, the femur and osteoid osteomas come to, let's say, homogeneous tissues or bone surfaces, easy to model. Can you think of more complex structures like the spine and model then the temperature distribution into the spine, close to the spinal cord?
Yeah, so one of the future extensions of the simulation is to move it towards soft tissue tumors, actually. But that's a good point. Yeah, that's a future direction for sure. Yeah.
Thank you.
Yeah, thanks.
Quick question. In the case where you showed where your prediction of the thermometry looked better than the actual measured thermometry, how did your simulation match the ultimate NPV? Was it a good match between what the ultimate non-perfused volume looked like after the treatment?
Sorry, which one are you talking about?
There was a slide where you were showing your predicted thermometry at the site of the osteoid osteoma, and then you showed relatively poor thermometry from actually within the sonication. How did the NPV compare? Did it match pretty well with your simulation?
Sorry, I can't comment on that right now, but I can see you after in order to give you a better explanation. Yeah.
I have a different question. In the graph that you showed of your simulation against your temperature, your measured temperatures are Voxel averages. Do you account for that in your simulation?
What's that, sorry?
The MR thermometry will give you a Voxel average.
Yeah. Oh, so it's tracking basically the hottest pixel and comparing the hottest pixel of the simulation as well, and comparing those two. So that's why you see the higher standard deviation, right?
So the simulation has similar size?
Yeah, exactly, yeah.
Okay, thank you.
All
Thank you very much.
Thank you.
Thank you.